Ron, you let me know when we're ready to start.
Okay, Counselor. All set when you are, Counselor.
All right, I'm ready to get going then. Might as well start on time. Thank you, Ron. Good afternoon, everyone. My name is Anissa Asabi-George, and I'm Chair of the Boston City Council's Committee on Education. In accordance with Governor Baker's March 12, 2020 executive order, the City Council will be conducting this hearing virtually. Today's hearing is on docket number 0179, order for a hearing regarding ensuring all Boston Public Schools have a full-time mental health and social and emotional support specialist. This hearing is being recorded and live streamed on boston.gov/city-council-TV. It will also be rebroadcast at a later date on Xfinity Channel 8, RCN Channel 82, and BIOS Channel 964. We will take public testimony at the end of this hearing. If you wish to testify, please email ron.cobb, C-O-B-B, @boston.gov to sign up. When you are called, please state your name and affiliation or residence and limit your comments to no more than 2 minutes to ensure that all comments can be heard. You may also submit written testimony by emailing ccc.education@boston.gov. Today, I'm joined here with Councilors Flynn and Mejia. I will briefly introduce the panelists before giving my colleagues a chance to give brief opening remarks. Ilya Tabora is here with us, who's BPS Assistant Superintendent of Student and Community Impact. Ms. Jill Carter, who's the Assistant Superintendent for the Boston Public Schools Office of Health and Wellness. Dr. Yvonne Barrero, Program Director for BPS Behavioral Health Services. Carmen Calderon O'Hara, who is a BPS Director of Social Work, and Blair Dawkins, who is a BPS Financial Analyst. We also are joined by a few others from the Boston Public Schools who are available to answer questions as necessary. I also want to note, just since we've started, that Councilor Arroyo has also joined us. So I'm going to invite my colleagues for a few brief moments of opening statements, if you have them. Councilor Flynn.
Thank you, Councilor Asabi-George. I want to say thank you to you for your leadership on this issue. It's critical that every school have the right mental health counselors, social workers, making sure that these services are available in every school, and that we have many of these counselors that are also fluent in various languages to make sure we reach our families in the BPS system that might speak another language other than English. Thank you, Councilor Asabi-George. Thank you to the panelists as well. Thank you to the BPS team.
Thank you very much, Councilor Flynn. Councilor Mejia, brief opening statement.
Yeah, thank you, Councilor Asabi-George, for bringing us together. And I'm so incredibly excited to see so many of my BPS people in the house. Blair, I see you. Yeah, so anyways, I'm really excited to be here and to support all things that deal with social and emotional well-being for our students. I'm here for all of it and full support. So thank you so much for hosting us.
Thank you, Councilor Mejia. Councilor Arroyo.
Thank you so much, Madam Chair, and thank you to BPS for being present today to talk about an issue that frankly is incredibly important to me as well. Most folks know that I am a BPS product, but also my mother was a BPS teacher for 30 some odd years. And before that, she was actually a guidance counselor in that same vein in BPS. And my sister currently teaches at BPS. And one of the things that I know, and for the record, when I was in law school, I was in CPS, I was in Chicago Public Schools, teaching a course on law. So I've dealt with education from a different couple different facets. And one of the things that I find to be universally true is that as a society and as a country, we don't do a great job dealing with mental health. We don't do a good job acknowledging it, but we also don't do a good job treating it and being honest about it. And when it came to education, my own, the ones I saw, I experienced through teaching and also through observation when I was in BPS, mental health is sort of an undealt with issue in BPS. And you can't really teach whole children unless you really get that in line and you really address it. And I think the trauma that we were dealing with before that is obviously intergenerational. It's current. It's about what their current situations are that they're living in. But we also have a reality that we need to address where COVID just existed. And so before all of this, we were already not meeting that need to the level that I think we needed to. And now we're talking about more trauma and more need. And so this is an incredibly important hearing. I look forward to asking questions that I hope have answers, but I also thank you all for the work that you're doing to really address this issue. It's much needed. So thank you, Madam Chair, for your efforts, and thank you to BPS and the work that you're trying to do to make sure that we actually close the gap on this. So thank you.
Thank you, Councilor Arroyo. And just for me, over the last 7 years, we on the council have worked with BPS to have a full-time nurse in every school. We're very thankful to have reached that goal at this in time for this pandemic. Simultaneously, I've been urging the district to also ensure that every school has a full-time mental health professional on staff. From my experience as a teacher and as a parent, I know that mental health support is not extraneous to education. When our students are in crisis, learning cannot happen. When our students are depressed, are struggling with their trauma, or in need of emotional support, they are not able to fully participate in their classes. Without support, maladaptive coping mechanisms may interfere with the student's ability to lead a full life. This pandemic has been a horrible crisis, and it has shown us much we all rely on. It has shown us how much we all rely on each other, and how isolation, disruption, and trauma can take a toll on our mental health. Our students are all feeling the mental health weight of this pandemic too. Since the beginning of the pandemic, I was grateful that the district strongly encouraged our teachers to incorporate social emotional learning and time for relationship building in the classrooms. In our October hearing on BPS mental health providers and special education, we learned a lot more about integrating SEL district-wide, the mental health services available this past summer and during the school year, and the district's efforts to expand the cultural, racial, and linguistic diversity of its behavioral health staff. It is important that we keep in mind that social and emotional learning cannot be taught like a content in the way that we do writing or reading. Social and emotional learning has to be present always. To do so, that SEL and mental health specialists are available to support our students and our educators, and that they have the appropriate training to identify and respond to behavioral health matters before they become a crisis. We know that all of our students are stressed by this pandemic, and that many of them are having a hard time with their mental health. We must ensure that they can access psychologists and social emotional support specialists. The impacts of this pandemic are going to be with us long after we're all vaccinated. With this, I'll turn it over to our panelists for opening statements. I'm not sure of the order that you all have decided on, but I welcome you to the Boston City Council.
Sorry, thank you. I think I am trying sharing my screen. Am I doing that?
We can see it. Yes, thank you.
Excellent. So thank you so much, counselors, for having us. My name is Ilich Nayeli Tavora. It's an honor to be here as part of the BPS team to share with you our work around mental health and healing, and how we're trying to move that work along. As we start that conversation, I do want to ground us in the reality that you have actually talked about, right? That we are facing and confronting the facts that we are in a system fraught with inequities, and the status quo is not doing us justice. And so as we think about returning to school, as we think about developing plans, as we are developing plans to recover, we have to approach it from a different lens and really challenge ourselves, as I have asked my team, that includes the behavioral health team, to think about how are we doing the work differently? And even thinking about the pockets of success in our system, how has those pockets of success enabled the continuation of systems that have promoted exceptionalism, where a student's success like mine, where I was a product of BPS and public schools from Head Start to high school, is an exception and not the rule. And so thinking about that, centering on that, recognizing that the power lies in our students, in our families, we are moving towards a space that what Dr. Jen Wright talks about as healing justice, and moving towards healing centered engagement, where we're really uplifting the voices of our students and families. That's the work we have to do. In order to do that well, we have to double down on our commitments. And so I want to share those with you and have a time to reflect on them. We have to think about eliminating opportunity and achievement gaps. And that's that work of rooting out racism and being critical around how our practices are perpetuating that, recognizing that to accelerate learning, we have to also promote healing, and recognizing that healing is an entry point to learning. In amplifying all voices, we have to be sure and committed to centering the voices of those who are most hurt, most closest to the pain, and making sure that they're a part of shaping the decisions and the pathways towards recovery and towards healing. Expanding opportunities, of course, cultivating trust in that process. And last but not least, activating our partners, as we know that this is not work we can do ourselves. We can't do it just with our staff. It has to be community as well, because at the end of the day, we cannot separate our whole human selves from our families, from our communities. And so I'm grateful to be a part of a team that recognizes and embraces that alongside the social emotional team. So I'll pass it on to my colleague, Jill Carter, who's going to talk about that work.
Thank you, Leach. And good afternoon, Councillor Sabi George and City Council members. My name is Jill Carter. I'm the Assistant Superintendent for the Office of Health and Wellness. Health and Wellness is in the academic division, and we collaborate with our colleagues from Behavioral Health Services on this important work. The Health and Wellness Office oversees the district's work on the whole child as outlined in our wellness policy, and the departments include in our division social emotional learning, health education, physical activity. And Carla Burley, the director of CEL, is here today with me to answer additional questions if necessary. While the entire city of Boston is working together to contain the spread of coronavirus, we have in Boston Public Schools have been continuing to find new ways to engage students. And we've been doing this by being deeply committed to meeting the needs of the whole child for every student in every classroom. This commitment is rooted in an understanding that students' physical, social, and emotional health and well-being and their positive development are directly linked with academic success. In the BPS strategic plan, as Leach just mentioned, we've outlined our commitments to eliminating opportunity and achievement gaps, as well as accelerating learning. And these efforts depend on our capacity to address both the health and the social challenges our students face, such as hunger, chronic illness, physical inactivity, poor mental health, and sexual health, especially for our students made vulnerable by systemic racism and other forms of oppression. To address these health disparities, BPS takes a whole school, whole community, whole child approach, guided by our district wellness policy, to make sure that students have the services, supports, and the educational instruction to be healthy now and for their lifetime. Every member of BPS, the BPS community, plays a role in supporting the health and wellness of our students. And we must work closely with families and community partners to reinforce, model, and support the development of health literacy and health behaviors. Both students and staff are returning to schools having experienced a wide range of events and emotions, including trauma, stress, and loss. It's essential that all schools are prepared to support our school communities through a healing-centered engagement, as Leach has just mentioned. As we consider our principles for academic recovery, we recognize that prioritizing the social, emotional, and physical wellness of students, families, and staff is the only way to adequately address the unequal burden of this pandemic on some of our BPS families and ensure health and safety during our return to school. The district's approach must be actively anti-racist and culturally responsive in order to be effective and in order to ensure positive health, learning, and life outcomes for our students. Focusing on individual and collective well-being builds trust. Once basic needs are met, educators should reinforce existing protective factors, build new coping skills, and expand equitable learning strategies. BPS schools must continue to welcome back students using strategies to build school communities that are safe, healthy, welcoming, joyful, anti-racist, and culturally and linguistically affirming. This is exemplified by the whole school, whole community, whole child model and approach to learning and well-being that's on the slide. You'll notice, Alicia, if you can just hit the next slide, there will be a few stars that come in. You'll notice the stars next to the part of the WSCC model that are being addressed today during our hearing include mental health specialists, social emotional instruction and climate, health ed, phys ed, and employee wellness, all of which play a critical role in supporting the social, emotional, and well-being of our BPS students and staff. My comments will focus on instructional practices and programming for all students, and then I'm going to turn it over to my colleagues from Behavioral Health Services to talk about specifically the mental health specialists and services. So you can go to the next slide. Thanks, Ilich. BPS has focused our efforts on strengthening social emotional learning through a whole child approach, where SEL is a lever for equity and should be part of teaching practices in all of our classrooms. Decades of research have illuminated that social emotional development is central to learning and critical to the physical and mental health and well-being of our students. At BPS, we believe that strengthening adult and youth social and emotional skills and competencies enhances our abilities to connect and relate to others across race, class, culture, language, gender identity, sexual orientation, and learning needs. Our SEL competencies were updated in 2019 to reflect a transformative SEL approach, an equity-based approach to better align with CLSP, culturally and linguistically sustaining practices. Transformative SEL is a process whereby young people and adults build strong, respectful, and lasting relationships that facilitate co-learning to critically examine root causes of inequity and to develop collaborative solutions that lead to personal, community, and societal well-being. Through the process of youth and adults learn essential life skills and competencies and promote a positive identity, healthy relationships, and agency to successfully navigate their future. Boston Public Schools is leading the way in the national landscape with the SEL competencies being inclusive of equity and being more specifically culturally and linguistically responsive. Please, next slide. Over the past several years, BPS has been engaged in refining our district vision and strategy for SEL. Through partnerships with CASEL and the Rennie Policy Center, we have assessed the current landscape for Tier 1 SEL programming and created a steering committee to clarify our priorities to move this work forward. Based on our own and national research findings, we are threading transformative Tier 1 SEL practices throughout the day and building and the building. This includes focusing on adult SEL for all staff, but especially teachers and paraprofessionals. It includes incorporating teaching practices that build community, student and student-adult relationships, prioritizing a focus on learning conditions and experiences that support students thriving. We want to deepen existing SEL programming and curriculum, including through physical education and health education, and we've been integrating SEL even into the arts. Through research grant opportunities, we are learning more about the implementation of SEL in service of equity. Early findings suggest that our SEL coaching model is having an impact, increasing ratings of climate, SEL instruction, SEL integration, and student collaboration in the research schools. By providing adults with the opportunity to learn about SEL competencies in partnership with colleagues and students, they are better equipped to create a learning environment where social emotional competencies are modeled and embedded into instructional practices. Next slide, please. Thanks. Last spring, almost 100% of BPS school leaders completed a CDC school health profile survey, a survey designed to assess school health policy programs and practices. Survey results indicate that 97% of school leaders agreed or strongly agreed that their school is committed to supporting the student's social emotional learning and development. 79% of school leaders agreed or strongly agreed that all of their staff received adequate training on the BPS CEL standards. 71% reported implementing at least one CEL curriculum partially. 33% of school leaders reported that restorative practices are fully in place, and 45% reported that they are partially in place. How does this compare to the national data? According to CASEL, through a national principal survey on social emotional learning, we found that 38% of schools have developed a plan for teaching CEL, but have reached only partial implementation. So our data is in line or a little bit stronger than the national research. On this slide, you'll see a focus on adult CEL. We know that high quality professional learning and school support are critical to improving social emotional learning. And this summer, we prioritized training school staff on adult CEL. Over 2,000 educators participated in our Boston Strong CEL professional development sessions focused on adult CEL and creating a welcoming online learning environment. All principals also received an overview at the August Leadership Institute. 33 transformational schools with over 250 educators and leaders also participated in additional adult CEL professional learning. And in partnership with Rennie and CASEL, we hosted a transformational CEL convening with 150 BPS participants. Developing educators' social emotional learning skills lays the foundation for the success with students. This allows them to focus on integrating CEL competencies along with CLSP into their instruction and their interactions with students. Research indicates that teachers who possess social emotional skills have more positive relationships with their students and peers and are better able to create academically supportive environments that engage students more deeply in learning. Next slide. Boston's most recent youth risk behavior survey results reinforce the importance of the topic of our hearing today. They really reinforce the importance of prioritizing students' social, emotional, and mental health and well-being. This population level data allows us to quantify the prevalence of behaviors and experience that lead to poor health outcomes. The 2019 results indicate a lack of school connectedness and perceived trusted adults. 42% of high school students did not feel close to people at their school. Notably, feelings of belonging and connectedness were significantly lower among students of color. Among middle school students, 44% reported that there was not at least one adult in their school that they could talk to if they had a problem. 35% of Boston high school students and 27% of middle school students experienced persistent sadness. Over the previous 2 years, the proportion of high school students who have attempted or considered suicide increased significantly to 9% and 16% respectively. Middle school students, particularly those of color, reported even higher rates of suicidality. 11% of middle school students reported having ever tried to kill themselves, and 23% seriously considering killing themselves. What is also important is that sexual minority youth are particularly vulnerable to mental related issues. Students identifying as gay, lesbian, or bisexual were 2 to 14 times more likely to experience depression, suicidality, and self-harm than their heterosexual peers. These numbers are alarming, and yet they were reported prior to the isolation of the past year. We must prioritize social emotional development and mental health well-being as we return our students to our building. To actualize our academic vision to provide every BPS students with a high quality, culturally and linguistically sustaining and well-rounded education, social emotional learning must be intentionally integrated into the practice of every school, in every classroom. And finally, we must foster environments of belonging and connection that center on student identities and experiences and allow them opportunities to feel seen and heard through the use of transformative CEL. We must also teach and model CEL explicitly as part of our efforts to develop health and physical literacy of our students through health ed and phys ed. CEL is essential for preparing our students for career, college, and life readiness. And thank you. I will now turn over the mic to my colleague, Dr. Yvonne Barrero from the Behavioral Health Services Department.
Thank you, Jill. And thank you, Counselor Asabi George, for inviting us here today, and to the other council members. We are really excited to share with you our vision for behavioral health services and the work that we've been doing, not only this past year, but through the department. So behavioral health services has a comprehensive role, and that means comprehensive behavioral health model, which was created with the support of Children's Hospital and the University of Massachusetts here in Boston. And this model really presents, you could see it in the visual to the right, presents an overarching support for all of our schools. So if you look at the essential components at the bottom, everything we do, we base it on the instruction, assessments, and data decision-making. So just like Jill was saying, we also use surveys, and we gather data to really focus our work. Based on that, then we provide intervention for all of our students. That would be a tier 1. This is the multi-tier systems of support. And this prevention model is given to every student in BPS. So CEL would be that tier 1 intervention, social emotional learning. Once the students are seen as having some issues or falling behind in any either academics or social emotional learning, they could be moved into the tier 2, which is a more targeted intervention plan. And this is for a smaller group of students that might be at risk of specific either academic need or social emotional needs. Once those students continue to make progress, if they don't, they move into a tier 3 intervention model. And that is more restrictive, more intense interventions. And this is, of course, done through our psychologists and our social workers, but also other supports in the schools. That could be a CEL coach, it could be an RJ coach, it could be reading and math coaches as well. Now, after tier 3, if the challenges continue, then we move into the special education referral process. But here at Behavioral Health, our focus is trying to keep everything in the tier models and really providing the supports they need. We also, as you can see in the slide, we do cover the special education services where we do psychologicals and psychoeducational assessments and tier supports that are not part of an IEP. That are part of IEPs as well, like a 504. Our work also is really grounded with partnerships. So that's at the top of our lighthouse. And these partnerships are critical to our work. We have hospital partnerships like Children's Hospital that I've already mentioned, but we also provide supports with these hospitals on professional development and referrals for services, more intentional services for our families and students. We have partnerships with universities, in Boston being such a university town. We have all sorts of partnerships with interns and practicum students, and Boston is a hub for that continuing education for the university, graduate university students. We have community partnerships with agencies here in the city that provide different kinds of supports. So it could be supports from housing and food assistance to other community partnerships like the Boys and Girls Club. And our mental health partnerships are also critical to our work. And this, not only do they come into our schools, but they also serve as referral agencies for us. So students, as I was mentioning in the tier 3 intervention level, if they need more intensive family support or family counseling services provided at home, those we would refer to our mental health partners to do that type of work. So I also wanted to mention that our BPS staff, psychologists and social workers, we provide special education support to early childhood centers throughout the city, out of district placements, students who require more intensive supports, and proportionate share students and families. The proportionate share group of students are students who live in Boston and attend private and parochial schools throughout the city as well. Next slide, please. And as Councillor Arroyo mentioned, we during the COVID times, this has been very challenging for all of us, not only for our students, but also for our staff, as we've had to move from a in-person learning style to a remote learning style and become used to virtual platforms like this Zoom meeting. But our services have never stopped. In behavioral health, we've been providing individual and group counseling throughout the year, even over the summer months. And we continue to provide crisis management during our regular vacations. So Christmas and a February break, we have provided crisis hotline where students can check in if they have any needs. We will also provide that during April vacation. We have continued to do our assessments. We are now in the middle of trying to cover the backlog. Many families opted not to continue with assessments during COVID, but now that schools are reopening, those students are coming back and we are addressing those assessments. We have done home visits virtually and in person, of course, following all the CDC guidelines. One thing we're particularly proud of are the parent webinars we've been able to do to provide families with supports around topics like anxiety, mental health, even setting up their computers and how to access information with technology. These have been language specific, and we have a library of them right now available for buildings who want to continue to use those and offer them to parents. We are also doing coffee house hours for parents. These are after school and can be language specific if the school requires or requests such service. And these are open to families to come and just have conversation with our mental health staff and have question and answer periods, or we might bring in a speaker or present some sort of interventions or supports for families. So those have been really successful. We are having a new round come April. We have continued to do referrals to our community partners, especially those that reopened, because many of them had shut down their services and now they have reopened them. So now we're going back to using our community partners more and more. We've also provided support to our school staff in our different buildings, providing them with trainings, because they're not, students and families are not the only ones having to learn new ways of communicating, right? We have also been using our restorative justice practices to work on school climate and develop communities, because, the online community is hard, right? We like to be together. So having to change that, we've been using our restorative practices to do that. And we continue to offer our work around affinity groups and equity roundtables and supporting our staff and our schools in those two measures, and our work that is committed to end racism and those practices, like Elich was mentioning at the beginning. And this staff really shows our multilingual school student-facing staff that we have here in behavioral health. We have broken it down by languages and race as well. 25 of our current school psychologists are bilingual, or we have a couple that are trilingual. 4 of our district social workers and 30 of our transformation social workers speak another language. And we have it broken down here by race. And we also have our staff here at Behavioral Health. We also have, of the 3 administrators, 2 of us are Latinas, Carmen and myself. And we have one of our secretarial staff is also Latina. So we are very proud of our diversity in our program. And Now I'm going to pass it on to Carmen, who will talk a little bit more about staffing. Thank you.
Thank you, Yvonne. Thank you, Councilor Salvi George, for hosting us today, and to the other councilors who are here. I am incredibly excited to talk to you today, in particular because March is Social Work Month, and this marks School Social Work Week. As many of you know from yesterday when you graciously gave us a proclamation, so thank you for that. Shameless plug, I'm going to encourage you to visit our website in CBHM Boston so you can see the highlight that we've done on bios under some of our social workers and the work they're doing, particularly because many of them that we're highlighting are BPS alumni. So to encourage you to look at that. In the spring of 2020, I was hired as a director of social work, and I was immediately tasked with hiring our transformation social workers. So got to work right away. We were able to hire the 57 transformation social workers, with 68% of them identifying as candidates of color, and about nearly 32% of them identifying as BPS alumni. So we're very proud of that because we recognize the importance of our staff representing the students and families that we serve. And of course, our alumni also bring lived experiences in our schools. So that's important to us. When you think about this school year's capacity in terms of mental health and specific to school social workers and psychologists, we had 30 schools that had at least one full-time transformation social worker and 10 that had part-time or half-time social work support. For next year, we are projecting as of today that 89 schools will have at least one full-time social worker. When we look at the school psychology picture, it's a little different. For this school year, we had about 25 schools with a full-time psychologist, and we are projecting that only 31 schools will have a full-time psychologist next year. So as you can see, the social work capacity has increased significantly. We are incredibly grateful to the mayor and the superintendent for recognizing and prioritizing the importance of these supports for our students and families. Next slide, please. As we grow this department exponentially, we have to be incredibly strategic on how we do that so we can do it successfully in a way that supports our social workers and makes sense. So we will continue to expand or replicate really a recruitment process that we used last time around by conducting targeted outreach. We are ensuring a diverse pool that way. We're reaching out to local schools of social work. We're using social work associations, social media, and really word of mouth of our current social workers. Many of them are very connected to lots of networks, and we're hoping to use them in this process as well. We will replicate again the central vetting process where we screen our candidates centrally, and then schools can pull from that database to ensure that our candidates come with a racial equity lens and a self-awareness about this work. And we're also prioritizing trying to make sure that our candidates meet the school community's linguistic and cultural needs. Obviously, we have to support our social workers so that they continue to grow. This is an area that I'm particularly proud of as a 25-year veteran of the district as a social worker. This is something that hasn't happened in the past, so or has been very sporadically happening. So I'm really proud that we are providing monthly professional development to our social workers with a focus on building their capacity for anti-racist systems work. We plan on training all of our new social workers on restorative justice practices for the many reasons that all my colleagues so far have talked about, and the importance of RJ practices. And we are looking to create a peer coaching model next year as the capacity increases. We want to make sure that they're getting the support necessary on the ground. One of the things that I want to prioritize too is the ability to do some case consultation. They're dealing with some pretty complex, sometimes, and very sensitive cases, so they need to be able to have a sounding board or someone that might have a little bit more experience, more seasoned, who can help them navigate those decisions that need to happen. In order to do this well, we have to rely on our partners. We've been talking about that now for a while. We are working very strongly with our local schools of social work to strengthen our internship program. We have lots of interns providing critical services to our students and families. In the past, we really didn't keep track of that too well. We're really trying to change that to make sure that we have a clearer sense of who is in our schools providing and how many interns we have. We also with the idea that we want to create pipelines for a diverse workforce. So one of the things we're also working on is to hopefully create a program alongside our recruitment, cultivation, and diversity office to develop a pipeline program for our current staff who might be paraprofessionals or even teachers who are interested in pursuing a social work degree and being able to give them that opportunity while still working through BPS. And a long-term vision, I can't say that this is gonna happen, I would say this year, but long-term, we'd like to create a pipeline program too, or an opportunity for our high school students to also have an opportunity to explore the social work profession, because we know lots of interest in that area. And as I just talked about, I mean, so many of our alumni, so many of our new social workers are alumni. So clearly there's, I think, potential for a lot there. In this new investment for the 21-22 school year, school leaders were given the option to submit a waiver and utilize the funds for positions other than social workers. Some of the positions that could request instead of social workers were a psychologist, a CLSP practitioner, a cultural linguistic sustaining practices practitioner, a hub school coordinator, or a restorative justice practitioner. In order to do that, school leaders had to submit a racial equity protocol tool with input from the school community, and they had to meet with our central office team. As of today, we have approved 15 waivers for one of the positions mentioned above. So I've given you, actually, can you go back to the previous slide just for a second? Thank you. I've given you an overview of the social worker staffing numbers and sort of the infrastructures that we're working on to support them. But what I want to do for a few minutes is just give you a deeper view of what our social workers actually do and our vision of that work. So as you've heard before, we are approaching our work from a healing center engagement point of view. What does this mean is that we recognize that trauma is experienced collectively and individually. And so healing also happens collectively and individually. So we come to this work recognizing that our systems are the ones that are broken and that they need to be fixed. Our students don't need to be fixed. Our families don't need to be fixed. And that we have to treat them or do our work from an asset-based model and not thinking in a deficit way. So what does that look like? How do we do this? So our social worker roles have been created in a 50% split of 50% direct work and 50% anti-racist or systems macro work. Direct work, it's probably easier to understand. You're probably a little bit more used to hearing that, like counseling, crisis management, connecting families to resources like food, housing, legal advice for immigration issues. You know, our social workers are delivering food bags, coats, Chromebooks to families, right? Doing home visits for students who are absent. They might be sitting with a student or a parent who's sharing a traumatic experience or students expressing a desire to hurt themselves. They're often supporting an entire school community that has experienced the loss of a classmate or perhaps of a teacher. So these are just some of the examples of many of the things that the social workers do on a daily basis. The other half of the work, or what we call the systems work, is making sure that the culture and climate initiative in the school come from an anti-racist lens. We're talking about perhaps professional development with staff to explore how trauma impacts learning, or maybe holding affinity groups with staff, supporting equity roundtables, or even as an example, one of our schools, a social worker with a team created a protocol on how to address a colleague who might commit a microaggression. So this is the work that's critical for change. This is what happens. This is the work that creates transformative change in schools, but that it's also often overshadowed because more urgent needs are pressing, right? Like crisis. So we're hoping that by creating this role that is a clear split, we prioritize this work just as much as our direct work. Next slide, please. So don't be scared by this slide. I know it's a little full of text, but I thought I'd give you a visual of who are the people in our schools doing the mental health supports. there's a lot of work to be done, right? But we have many partners in this work that's supporting the mental health of our students. In this visual, you can see our school psychologists, our social workers, both district social workers and school-based. And the difference between those two is that our district social workers are centrally housed and they're deployed to many schools, whereas school-based social workers are only supporting one or perhaps two schools if they're part-time. Our mental health partners and our school counselors, who often are referred to as guidance counselors. I want to highlight that generally speaking, this is how these roles, when I talk about these roles, this is what generally speaking happens, but there are obviously sometimes exceptions because every school community is unique and different. So our school psychologists typically serve 2 or more schools and serve in a very comprehensive role, as Dr. Guerrero already explained. Our mental health partners, as I said, our district social workers are usually deployed to several schools as well. Our mental health partners are community-based organizations that provide services in our schools. Their services are vary according to their funding. So some provide very comprehensive services, but the majority of them operate on a fee-for-service basis. And our school counselors serve one school typically and provide critical services across all tiers, as you can see. And they're the only providers that are overseeing the college and career readiness important work that's so critically important to our students. As you can see, our social workers and our school psychologists are working across all tiers, meaning they support all students. Their roles are incredibly comprehensive. And one thing that I want to highlight too is that you'll notice that they are the only ones in this visual that are providing the most intensive services under special education, because they are the BPS staff that hold the license, they're licensed mental health providers. And that's an important thing to point out because the district gets reimbursed by Medicaid for those services. I hope this gives you sort of a simple overview. It's way more complicated, obviously, but a simple overview of how mental health services are provided in our schools. And I'm happy to take any questions later. And so I'll now pass it on to my colleague, Blair Dawkins, who is a financial analyst in the budget office.
Thank you, Carmen. And I wanted to thank the City Council for this opportunity to share about these critical supports for our students and school communities more broadly. The fiscal year 22 budget proposes a $1.29 billion general fund allocation featuring targeted investments in academic, health, wellness, and community supports. These investments are aligned to the 5-year BPS strategic plan and the proposed funding to strategies with a demonstrated ability to improve outcomes for the district's highest need students. 100% of new investments proposed in this budget go directly to schools or school services that are budgeted centrally, such as the social workers that Carmen mentioned earlier. Of these new investments, $10 million will go to funding new social work positions. This investment in social workers for fiscal year 22 has been placed on general funds. This was an intentional decision to ensure that the district is being responsible and forward-thinking in creating the conditions for long-term investment in places where the need for that is clear. We're hopeful that this investment is laying a strong foundation for the district's reimagine work going forward. In over 2 years, the district has transformed our foundation for quality in schools, guaranteeing that all students in school communities have access to critical resources. And one highlight of this transformative thinking around the foundation for quality during this time has been the addition of 142 social workers. The next slide. The fiscal year 22 investment in social workers is building upon our fiscal year 21 investments by expanding school social workers beyond transformation schools, bringing at least a 0.5 social worker to every BPS school. We have worked hard to ensure that social workers are culturally, linguistically, and racially reflective of our students, and that they are receiving the training necessary to be culturally responsive to our school communities. Social workers will be providing both individual, student, and family support while also working to address racist and harmful structures and conditions in schools. District social workers will be contributing to the design and implementation of school-wide culturally and linguistically sustaining practices using an intersectional anti-racist lens. And now I'll pass it to Assistant Superintendent of Student and Community Impact, Ilich Tabora, to close us out.
Thank you. So just to close, I want to thank everyone, all of my colleagues for sharing your words and your work. I will share that I joined as Assistant Superintendent in September, coming from the Office of Opportunity Gaps. Really proud to work alongside the behavioral health team, as well as the health services team, which is our department for our school nurses, the restorative justice team, and our hub school strategy. And in fact, all of this work around moving towards healing-centered spaces, and I love that we're clinging to that research around really centering our voices of our families and students to heal and to create spaces of community, really speaks to the work around what we will be doing with our hub school strategy. And so taking a step back and thinking about how do we do this as not just a team of mental health clinicians, but as a whole team, BPS, as a community, as a city. And so we welcome your partnership and thank you for it in this work.
Thank you very much, everyone. Thank you for the very thorough presentation for sure. Just so colleagues know that we will be sending this PowerPoint. If it isn't in your mailboxes already, it will be shortly. I'd also like to note that we've been joined by Councilors Braden and Wu, and Councilor Campbell sent a letter noting her absence today, and she will, I'm certain, watch today's video and review the PowerPoint, the slide deck. I will ask also my colleagues to limit their questions to 5 minutes, and we'll certainly do a number of rounds as necessary. This is really, really great. So I'm going to just start with a couple of quick questions. I hope they'll be quick, and I certainly won't use that first 5 minutes myself. What was most glaring to me and worrisome to me is the data around the student reports and sort of the persistent sadness, the suicide contemplation, and the suicide rate. And that is 2019 data. So 2 questions. How do we account for what we suspect will be a huge bump in those numbers, and particularly concerning to many of us, if not all of us? And then generally, so how do we anticipate the 2020 data to reflect sort of the impact that COVID has had on all of our kids in our communities? And then also, how do we specifically respond to all of that data very directly in our schools, in our classrooms, and as a district? I'm not sure who can take that. I know it's sort of a bigger question, but I'm really worried about that data is not good data, and it's from 2019.
I don't have an answer for you that might be satisfactory. And Joe, I don't know if you have any. Okay.
I'll let you. I mean, I was just going to speak to the fact that in this coming fall, we will do the 2021 Youth Risk Behavior Survey for both middle schools and high schools. So I just wanted to acknowledge that we will have that surveillance data available then to get a further picture about COVID, but I'll turn it back to Alicia about the response part of those questions.
You know, actually, I'll kick it off to my team. Carmen, what you're speaking of, Counselor Asabi George, is real. As a mother of a teenager who is suffering through that isolation as a high school student, I totally feel you, understand you, and we're actually seeing this reality play out in our schools. And so that's actually the work around our crisis team, and our behavioral health services plays a critical role in that. How do we think about addressing the crisis, knowing that it's going to be exacerbated by this pandemic, thinking about, we might actually have to think about what community partners do we pull in more? How do we build the capacity of our community, of our students, of our families to be able to respond? And again, take ownership of their own healing. But I'll toss it to Carmen and or Dr. Borrero in case you have more to share around the crisis response work.
I'm happy to jump in, Yvonne.
Yeah.
I think a couple of things. I appreciate. I thank you for your question, and it's something that it's been forefront in our mind. I have a senior at home. This has been incredibly painful watching her spend her senior year in her bedroom. We know this is coming. I think we go back to our multi-tier systems of support. Our tier 1 cell has to be solid. We have got to use our RJ practices in our schools to welcome our students back, to give them a space to tell us what they're scared about coming back about, because many of them have much anxiety around the variants, or just, readapting to being around people, right? So providing that space in schools, it's going to be really important. And also for our staff to have that space as well. I think we are deploying our crisis team as we are seeing the need rise in particular schools, and bringing their clinical teams together. So their school psychologists, their social workers, their mental health partners, their student support teams to really talk about what are we seeing and what is the plan? Because it's going to take the whole community to bring them back safely. And as Elich said, we have to utilize our partners strongly in this particular case. So
we didn't do a youth behavior risk survey this school year. We weren't able to conduct that.
It's an every other year, and that's
I didn't realize
we
that.
would have
Okay.
yes, we would have typically, like the rest of the country, done it this spring, but it is required that students be in person, not done remotely. But so that's why we weren't able to do it, but we will be doing it in the fall.
Great, thank you. Dr. Barrero, anything to add?
No, I think I just want to emphasize that our services haven't stopped. We
Right.
continue to see kids. We continue to check in with teachers. We have our psychologists in every building. They're checking in. They're available to give, on the spot support, as well as through our crisis team intervention. So we've been working nonstop in supporting our families, and I think that the reopening, opening just K-3 has given us that opportunity to kind of focus on those kids and kind of move them along, and then we'll get the next batch and so on. So that has been helpful this fall.
Thank you, Dr. Barrero. Thank you all. Counselor Wu. I'm sorry, Counselor Flynn. Went just look at my notes reverse. Counselor Flynn.
Thank you, Councilor Asabi George, and thank you to the BPS team that's here. Just want to ask, I guess, two quick questions as we approach the City of Boston budget process. Are you advocating for enough funding in the budget so that we guarantee to have the right and necessary number of professionals in each school, mental health counselors, social workers, those that are able to speak other languages as well, communication related issues. But are you going to make sure that you advocate for the money in the budget this year for a mental health professional in every school?
Yeah. We are advocating for that, for a mental health professional in every school. There are a couple of schools that are non-WSF funded, so non-weighted student funding, that have more robust mental health supports already in their schools, that have waived adding a social worker. But other than those schools, we are advocating in the budget to have a mental health professional in every school.
Okay. My second question is, this pandemic has been a very difficult year, obviously, for our students, but also for Asian students. Many people around the country, unfortunately, have, Asian community has been bullied and intimidated. Are you factoring these issues in as we go back to school, that many Asian students might need extra or specific counseling related to this pandemic, as if they're being blamed for the pandemic? And I know that there are many instances of anti-Asian racism, discrimination, bullying right here in the city and throughout the country. So I just wanted to get your thoughts on that.
Thank you, Counselor, for your question. Yes, we know that that is definitely an area of concern. Bullying is always an area of concern for all of us. And so our school psychologists and our social workers are ready to support students who are perhaps experiencing that. And also ready to do some education of the community if that's happening as they return to the schools. So.
And I'll add, this is part of why that piece around that systems work and that restorative justice training that some of our social workers will already bring to the table, but we're definitely going to embed is going to be critical in building community and allowing us through restorative practices to see each other as whole humans. It cuts down on that anti-Asian, that racist rhetoric, those biased perspectives, but also that systems work of the social workers in particular will allow us to think about not just from interpersonal situations, but think about systemically. What are we doing? What are the conditions in our schools that might be allowing or perpetuating for these instances to happen? And so how do we address it as a whole school, whole community? And part of that might be more collaboration with families and students. And so that's certainly something that is in the forefront of our minds.
Thank you. And then my final point or comment is, are you able to effectively communicate with Asian students? Their parents might speak Cantonese or Vietnamese. Are you able to communicate effectively with the parents, provide their parents with updates and advice and suggestions? Are these mental health professionals fluent in Cantonese that you want to hire?
Well, right now we have 2 Cantonese speakers and 1 Mandarin speaker psychologist, and they are placed in the schools where the larger population of Asian students are at. So we also provide language-specific training for families, and these psychologists support that work. We've also used interpreters if there's more than one event. So we use interpreters that we've worked with before and make sure that the language is what the families need. So yes, we are working on that.
Well, we have 2 Cantonese speakers in the BPS system. That doesn't, for mental health counseling, is that accurate?
We have three Chinese speakers, 2 Cantonese and 1 Mandarin.
That doesn't seem, I mean, with all due respect, it doesn't seem like it's enough to me. We have a large Cantonese community in Boston, and 2 mental health professionals. I don't know. I don't think that's enough. I think we have to be more aggressive about that and acknowledge that we have an issue here, and that we need to hire some more Cantonese speaking mental health professionals. I don't think 2 is enough.
I'm sorry. Doug.
No, I was just going to say, I agree with you. Unfortunately, some of our training schools, for many reasons, right, don't really attract a lot of minorities. Because we have the same thing, for example, Vietnamese. It's extremely difficult for us to find a Vietnamese speaking psychologist. We used to have one, and she's retired about 10 years ago. So it's not for the lack of trying. We are more than happy to hire more Cantonese or Mandarin speakers, but they're just not out there as readily as we would like them to be.
Sorry.
Do you think maybe we do some recruiting drives and efforts at some of these great colleges, people in the graduate program of social work, and maybe there's some Cantonese speaking young students there that would love to come to BPS and contribute, making a positive impact. Thank you, Councilor Asabi George. And I just want to say thank you to the BPS team as well.
Thank you very much, Councilor Flynn. And as I've over the last few years brought together a number of mental health professionals, the pipeline to culturally competent and multilingual and diversity challenges is a persistent problem among all of our graduate programs and our training programs in this space. Counselor Arroyo, you're next. Counselor Mejia had to step away.
Thank you, Madam Chair. I'm going to keep video off just so that there's no interruptions on my end. I believe I saw that you have 75 school psychologists. Is that correct? That's the number.
Yes.
How many of those school psychologists are people of color?
If you can go back to that slide, slide number 12. So we have psychologists, we have 25, I'm sorry, we have, the slide has the social workers as well.
Yeah,
So-
that's what I'm trying to, I know they put a whole bunch of different things in there, which is just, I mean, to be honest, I come from CPCS where we do really poorly with hiring people of color. It's Community Public Counsel Services, and so they would throw administrative staff and all kinds of other people in there to fix the numbers. I just want to know specifically on school psychologists, how many school psychologists are actually people of color?
Yes, so of those Spanish speakers, 32 includes this transformation social workers, but 12 of them are Latinos.
Okay.
And one is from Spain. So we counted her as white.
Yep.
Haitian Creole, we have 4 psychologists that are Haitian Creole speakers.
Yep.
And they're all Black. We have 1 social worker that's Cape Verdean speaker.
Social worker, school psychologist.
Yeah,
I'm
yeah, but she I just wanted to say that she is our crisis intervention liaison, and she helps us a lot with the Cape Verdean families.
Okay.
We have 2 Portuguese speaking psychologists. One is Black and one is white. In that, I think I covered all of those. The others, Arabic and Russian and German, they're all.
So it looks like maybe 20 something of them.
Yes, yes.
Okay, so it's like 30-ish%.
Yep.
Okay. So I'm somebody who actually is very open about the fact that I see a therapist, and I recognize that when we're talking about our school population, one of the things that I know for a fact is that when people of color are looking for school therapy or a guidance counselor or a therapist or a psychologist, and as adults even, it's the perspectives of people of color who are best able to usually connect with other people of color because they understand that intergenerational trauma and they understand the lens and the perspectives of their lives. And so I guess my question is this: how has the comprehensive behavioral health model been able to decrease disproportionality in special education? And if it hasn't, why hasn't that? And what are we doing to ensure that it's doing that? Because generally, these kinds of interventions, if we don't do them, the students hurt most by this are Black and Latino boys. So what are we doing, and how is CBHM doing what is CBHM doing to decrease that?
So yes, CBHM is addressing that disproportionality. And one of the ways we do it is that the psychologist is part of the school climate, right? School community. So psychologists will, and some of these are bilinguals, right? Will participate in school student support teams. There's a voice there. They also participate in after-school activities with families. And some of our of those webinars I mentioned about family coffee house and things like that, those are all done by our people of multiple languages. So we are putting in front of families and children, people who represent them. CBHM also has a training for the staff during the summer. Of course, last summer we weren't able to do that. So every school that comes on board for CBHM goes through this process where we talk about culturally sustaining practices and racial equity. So our white staff is trained, but our staff of color holds a very important role in this training. They're the people who come to the different activities in the building. They also consult with teachers and with principals, school leaders. So there's an active role of our bilingual staff in everything that CBHM does. We are also through CBHM doing a lot of training on racial equity. So that's also part of what we do in general. But yes,
So this is a question, and I appreciate all of the points you hit, but as a question, are we seeing a decrease in the disproportionality of Black and Latino boys in terms of these classifications that they're getting, where we know that it's documentedly that we're essentially assigning them more IPs, we're saying they have more behavioral health problems, we're doing all of those things at a disproportionate rate. Are we seeing any kind of impact yet on that?
well, that's hard to answer because this particular year has been challenging for us to gather certain data, right? So we would have to go to previous years. We do gather information on how CBHM establishes school climate. That data we do have. Of course, I don't have it with me right now, but we'd be more than happy to share that with you. The CBHM annual report has that data. So I could make sure that
so I guess as a question is, you brought up training and all these different things. Who actually is in charge of supervising the school psychologists and social workers?
I'm one of them, and Andrea Amador is the other. She's the executive director for behavioral health.
So is it just the two of you essentially? Are you the top of the team?
And yes, and then Carmen supervises the district-wide and the transformation social workers.
And so how many coaches or supervisors are in the schools to ensure that they're actually doing essentially what you're saying that we're asking them to do? How many actual coaches or supervisors do we have in the schools supervising the folks in the field?
Go ahead, Carmen. Yeah.
Counselor, you are asking an excellent question about capacity. And I'm so grateful for your question because this is an area we know we need help. You're absolutely right. As we increase these mental health supports, we have to increase our ability to support the people on the ground. If you remember in my presentation, I talked about that peer coaching model. That's not established as of right now. This is that is what we want to do for next year for our social workers. But right now, that capacity is not there for the school psychologists. So another shameless plug today, I have no shame. That is an area that we need a lot of help. And actually, it goes back to the original question, I think it was Counselor Flynn who asked, do we have the enough support? This is an area where we need support to be able to truly coach and give feedback to our psychologists and social workers on the ground around this work. One of the things that we're doing around the anti-racist systems work, Counselor, is looking at the trends of referrals for student support teams. If a student is referred, and we're looking at students are, again, trends that either Black or brown boys are referred at larger numbers than others, what does that mean? Let's dig deep into that data. But social workers and psychologists are not going to walk into a school knowing that necessarily without the proper training and without the proper support. So the capacity for that, we're getting there, but if you want to help us, we will welcome you.
Madam Chair, I know I'm short on time, so
actually well over time, but we will certainly do a special round. I also want to make a note, we will be having a very specific hearing on sub-separate special education classrooms. And, we certainly see the very uneven representation of Black and brown boys in particular in those classrooms. And I think that this conversation certainly can continue in round 2, but know that we'll also pick that up in a very specific way in that hearing. I also want to note that we've been joined by Counselor Bach, and I'd like to invite Counselor Braden to ask questions. Welcome, Counselor Braden.
Thank you, Madam Chair. Thank you so much for all the folks from BPS for a really incredible presentation. I really appreciate all the effort that went into producing such really good information and for your day-to-day service to our children. I had a question specifically about deaf and hard of hearing children. I noticed you had one social worker, or is it a counselor that is AS American Sign Language? And I know that from our local Horace Mann school here in Alston, that we have a very diverse student body from many different language groups in their family home, but they are primarily and the parents don't necessarily have great proficiency in American Sign Language. So I was just wondering, how do you tag team those situations with a with someone who a translator or someone who can communicate with the family while the professional is counseling the student, or does that raise some difficult situations perhaps? I just had more of a how you manage that question.
The Horace Mann School kind of hires their own team. So our psychologist does American Sign Language, but at the Horace Mann School, they have a variety of support systems that can really touch base with these particular families. Especially like there's the amount of students at the Horace Mann, the majority of them are of Hispanic descent. So they do have a lot of staff that speak Spanish, and then they could communicate with that family population better. But they are kind of an individual.
They're a special.
Model. Yeah.
Yeah. Very good. And it just happens to be in my neighborhood. So that was my question. And then also, I share Councillor Sabi George's concern about the number of students who have, reported suicidal ideations, and that was pre-COVID. So I think your request for additional staffing at this point, as these students return to in-person learning, and we try and deal with the trauma of this past year, I think it's really important that we critically address this issue and hope to try and repair the damage as far as possible. Just in terms of the logistics of that, what is your turnaround time for hiring additional staff?
I'll jump in. The hiring process takes a while, particularly as we're talking about large numbers of social workers. I can speak to the social work process. It's probably, they will not be in the buildings until September.
So that makes it equally urgent that we support your request and appropriate funds to support this work. I would imagine. In terms of a cohort of candidates for this work, do you feel that you have an adequate cohort of potential candidates in the Boston area that would meet this demand?
That's the work. There's a lot of work ahead to get this cohort, Counselor. We have to do some pretty aggressive recruiting. We're working with the Human Capital Office and particularly their diversity office, and they know that they do some efforts nationally as well. So we will connect with every possible source of a place where we will find candidates. And our current social workers are aware that we need their support through this process as well. So they will be fairly involved in that process. And I don't know if it's a little different for the school sites. I don't know if you want to talk anything about that.
No, that's fine.
Okay.
That's all my question. Or if there's anyone else wants to add anything, that's fine. That's good. Thank you, Madam Chair. Thank you.
Thank you very much, Councilor Braden. Under the 5 minutes, love it. Councilor Wu, questions for the panel?
Thank you, Madam Chair. Thank you, everyone. I will just keep it to one question, hopefully well under 5 minutes, maybe with two parts, which is, could you talk a little bit more, I'm sorry I missed the beginning of the presentation, about the chance to connect our sort of physical infrastructure facilities at BPS with direct services, whether it's through on-site at various schools or even using telehealth, and maybe there are ways that we can just guarantee deeper connections and availability, for example, with some of the language and cultural competency issues that we've already raised.
Counselor, are you referring to supporting the students in the building, like physically?
Yeah, I guess I'm thinking, it seems that there's been a move away from having, for example, community health centers or other clinicians on site at schools, and of course we want to support the continued expansion of BPS staff as well to provide cell supports. But in terms of these kinds of on-site partnerships, or even I was just thinking about whether that could be built out more now as there's urgency in the pandemic and recovery, and what perhaps the use of telehealth might be able to do.
I mean, our services, BPS staff providing these services have not stopped providing them. We did use telehealth. We continue to use telehealth when appropriate. Our staff is going back into the buildings as their students are, as those schools are opening. But in terms of partners, we have not, I'm not clear. That's a question that I don't know if Ilich, you know the answer to this question, but I don't believe that partners have been allowed to return to the buildings yet, mental health partners. I don't want to give you the wrong information, so perhaps.
Yeah, I'm not clear on mental health partners. I know we're working on strengthening our partnership with Boston Public Health Commission around the community school-based health centers, particularly trying to connect our health services department and our nurses with the team over in family, children, adolescent health. I think it's the bureau. So we're doing work on that. I'm not sure that I have great answers for you, Councilor Wu, but if you would like to say a little bit more, I think we'll do a little bit more digging to make sure we're getting at what you're asking for.
Yeah, and I would just chime in maybe that currently the Boston Public Health Commission school-based health centers are able to provide telehealth for BPS students. That was something that was rolled out sometime during this school year. I can't be exact sure when, but that's just the BPHC school-based health centers. So.
Thank you. Yeah, it'd be great to follow up a little bit on the partnerships at a later date. Thank you.
Thank you very much, Councilor Wu. And I do think that's a valuable question around the role of partners and their access to the buildings and their access to our students. Councilor Bach, welcome. Oh, where'd you go? Oh, there you are.
Thank you. Thank you so much, Madam Chair. I have arrived late, and so I will try. I'm going to just ask one question because don't want to ask you all to be redundant. And I would like to thank you for the presentation, which I've had a chance to review. And I think this is such important work, and we really do need to keep ramping it up. We've seen in the pandemic just how much, if we don't create strong supports for our students, how impossible it is to learn. And pushing for school psychologists and social workers is something that for me goes all the way back to working in Councilor Asabi George's office. So there's a kind of double appropriateness to being here today. I just wanted to ask about whether we've thought, as we think about really ramping up, and frankly, ramping up the number of these folks as much as like the council would like us to do, and thinking about what's been proposed before school committee and the school budget, have we contemplated at all, like, I'm just thinking about like a structure like BTR or anything, so that's Boston Teacher Residency, like a kind of a structure that could support. I just feel like even when we get these folks in every school, we're going to have relatively few of them. And so you're in a situation where you're playing like this critical social, emotional support infrastructure role, but you yourself are kind of alone. Or maybe it's just you and one other person in that school building doing that kind of work. And I just think about how do you support people in getting best practices in that work? And obviously that's like the role of your office, but I just wonder whether you've thought about, like, in the way we have mentor teachers and that kind of model in BTR, the more that we have these kind of professionals as a core part of our school environments, like how to structure professional development and mentoring and support for them in the way that's going to make it the most sustainable model. Because we don't just, I mean, right now you're trying to recruit aggressively in a very competitive market, and to Councilor Arroyo's point, right, especially when we're trying to recruit the kind of folks who have the cultural competency to work with all of our students. It's one thing to try to get those people in the door. It's another thing to keep them and have them feel like BPS is a supportive environment in which to be a social worker or school psychologist and sort of improve and nurture your practice. So I'm curious about kind of systems level stuff that we might be looking at on that front.
Counselor, thank you for your question. In the presentation, I talked about us wanting to develop a peer coaching model, not really having the capacity for this school year, but hoping to build that capacity for next year. I think your points are incredibly you're completely on point, particularly when we're dealing with our psychologists and our social workers, because they're dealing with some complex issues and cases, and making those decisions by themselves is really scary at times and emotionally draining too at other times. So yes, we're definitely hoping to build that capacity of peer coaching, strengthen our professional development program, and at the same time, we're also working on our pipeline programs with the local schools of social work. So if you refer back to our presentation, I forget the slide number, but it kind of highlights it. I have some bullet points in there that talks a little bit about that.
Yeah, this is under the central office infrastructure for social workers.
Correct.
Right. Yeah. No, I saw that, and that's that's exciting. I think I just would say, like, having watched a number of friends who are teachers go through the Boston Teacher Residency model, I think the kind of intensiveness of like working with a master teacher and also having a coach and kind of having like a multi-year support system around you to like launch you as a teaching professional in our system, like I've seen be quite successful for a number of people. And obviously BTR was also something that we set up with the goal of having a kind of diverse pipeline into the Boston Public Schools, right? And keeping teachers for a while. So I just think as we're ramping this up, to me, peer coaching is good, but peer coaching, that's just like something that I do, you know, once every 2 months with somebody, or it's like there's a difference in, right, the sort of like quality of mentoring and support. It can be really apples and oranges depending on what you set up. So I just wanted to flag, I think it's easier for us as we think about really growing this capacity to sort of set up those sustainable supports now than to not set them up and 10 years from now be like, why do we have a revolving door of social workers and school psychologists who are not like able to learn and grow and support our students in place, right? Like, so that's all. That was what I wanted to flag. But again, thank you for your indulgence. Sorry to show up so late, and I'm grateful to the maker for the hearing.
Thank you, Councilor Bach. I would just note, and I've started the timer for my questions for this next round, that oftentimes a lot of that revolving door, in my experience, both as a teacher and as a parent and as a chair of this committee and through this work, many of the revolving door challenges occur because of the partnership. So we as a district, when we hire the provider, there's a lot more stability in my mind and through my experience and, you know, longevity. But when we hire through partnerships, there isn't that same, you know, it isn't a lack of commitment from the provider. It's often because of the compensation, because of the benefits package. And when hired through the city and through the school district, it's just a much more, there's a different relationship and there's a different expectation for this is your career and this is where you'll be. I think that's probably accurate. Yeah.
Can I, Councilor Sabi-George, I just wanted to add that I also think the school-wide and district-wide work to cultivate trust and a work environment across the entire team, that idea of it takes a whole team, and building the social emotional competencies and relationships across social workers, teachers, and all the people in the building. I think that also is so important in keeping staff within BPS. And I think that's where we see transformative sell as being something that you really have to do throughout the whole organization. So, but agree with all the part about coaching social workers for sure.
Yeah. And then, you know, a lot of this conversation today and a lot of the investment is on hiring additional social workers into our district. And then maybe this may also be related to Councilor Arroyo's question earlier, maybe loosely related anyway. How do we determine or decide what the professionals are that we are hiring and advocating for and bringing in? Social workers, school psychologists, social and emotional specialists, school counselors, a more traditional, I suppose, guidance counselor. how do we determine what the specialty is, what the skill set is that we want to bring into our school communities? And how do we create maybe more flexibility or diversity around those licensed or certified professionals? And how do we maybe allow school communities to make some of the decisions based on their school community, what type of professional or certain skill set they may want in their school?
So thank you, Counselor, for that question. That's specifically why we designed the waiver process, in recognition that healing and mental health doesn't just come by one model, or in this case, a Western model of mental health. And as a consumer myself, I know the impact it's had on me, on my daughter, but it's not enough, right? In some cases. And so it also has a lot to do with the relationship. So we want it to be responsive to school communities. And that waiver process did actually end up, most of them, increasing the allocation of school psychologists, but also in some cases landed a CLSP practitioner, which really looks at how do we create healing centered spaces by way of instructional practices that lend itself to, the cell work that Jill talked about in connection to the work that the social workers and Dr. Borrero and her team and the school psychologists do. So that was the intention behind that, and in honor and recognition of what you're saying. So I appreciate your broader lens around advancing mental health and well-being for our students. Carmen, I don't know if you wanted to add. It looked like you did.
So then the last question, and I may have one more in a final round that will be quick, but around the budgeting, Blair, this is probably for you, and thinking about perhaps right sizing at least a little bit right now, and this as kids are starting to return to school now and understanding the trauma that many of them have faced. Is there any federal money or any access to CARES funding to add some of these services today or in the coming weeks as more and more school, kids return to school?
Thanks for that question. That would be something that I would have to take back to folks on my team and then get back to you. Yeah.
Oh, that's fine. I appreciate that. And I am curious if there was any access to some funding earlier on to get there. So we'll continue going through colleagues. I see that we've, Councillor Flynn must have another commitment. He has departed, as has Councillor Mejia. Councillor Arroyo, we're back to you.
Thank you so much. And thank you to Councillor Bach for raising those issues, because they're actually, it saved me some time because I was going to raise some of that myself. So thank you so much for that. So a quick question on a different track. How does the administrative team engage with families, students, and school leaders to solicit input, feedback, and ensure you're being responsive to needs at schools?
Also, can you repeat? I kind of didn't hear part of your question. Do you mind repeating it?
Sure, no problem. How do you all engage with families, students, and school leaders to solicit input, feedback, and ensure they are being responsive to their needs?
I can start that. Part of what we do when we are a student is referred to the school psychologist is we have conversations with families. So that direct connection, talk to me about what is going on with your student, tell me what you need. And then if it's something that needs to be referred to the social workers, then we connect them to the social worker. But it's that direct communication, one. And two, some of our schools have a parent liaison who then serves as that connecting agent between the families and us in behavioral health to then support the families. Hope that, Carmen, I don't know if you wanted to add something.
Well, I think to your question, that it relates a little bit in my mind to a question that we had earlier about capacity. And I think what you're talking about is an incredibly critical aspect of our work, is to continuously get feedback from our consumers, let's say, right? Our students, our families, but also our school communities. And I think the way that we gather that is really looking at our data, but also anecdotally and having conversations with our partners, so our school partners. So as we build the capacity of our department, that's an area where, again, our administration, there's only 3 of us overseeing right now, 100 and something people. And So it's a good area where would love to build our capacity. Let's
and I guess, you know, related to this, I imagine that it would be harder to do when the majority of your staff is monolingual. All of the things you just brought up, talking to families, having interactions with families, are we talking about bringing in interpreters and things like that? And we're talking to families who only speak one language about sensitive behavioral health issues and things of that nature?
Right. I mean, yes, absolutely. That's definitely more challenging when our providers don't speak the language of the family. We do have access to translate interpreters actually through a Lion Bridge program. I don't know if you're familiar with that, which is not ideal, but it is definitely, we always prefer to speak in the family's language for obvious reasons, but we do have access to Lion Bridge all the time to have a live person communicate with the parent or the family. So I will say, I think I can speak for the transformation social workers. A large percentage of them speak many languages or are bilingual at a minimum. So I think that there's definitely room for improvement in all of our linguistic capacities. And as I said, that definitely is an area of focus for all of us. So
okay, I'm just gonna move to make the most of time. In terms of what we saw on the slides, right? We talked about mental health and well-being requiring more than just counseling and clinical mental health supports, which I fully agree with. How is BPS expanding that approach to mental health, and our restorative practices, how are those being embedded in that strategy?
So in terms of the idea that all teachers really need to see themselves as part of that community that is really caring about the social emotional well-being of students, that is a firm expectation with training. We have social emotional learning competencies. We provide a number of professional developments, and we would like to continue to expand and continue to support teachers in that work. We have a number of tools and resources that we can also share with schools. And I can let Alich share a little bit more about the restorative practices pieces.
Thank you. Well, so the caveat here is that I joined in September, so I'm just in terms of leading the team that's doing this work. But I will, Councilor Arroyo, to respond to your previous question just very briefly, I personally have a commitment to meet with our transformation school leaders to ask for their feedback on how the work around our transformation social workers, as I know Carmen has been doing that with the social workers directly. So this is work that I'm committed to, in particular in our hub schools. What we want to do is make sure that we are creating spaces where families and students have input into the services that they have. And so restorative practices certainly is something we want to strategically embed and hopefully grow. If we're doing pitches, I'm going to pitch that one there. Being able to increase our capacity to do restorative practices, not as an intervention, not as there's an issue, I'm going to use a restorative circle to address it, but as a way of being able to connect with each other and see each other in all of our identities and their intersections. That is what is at the root of restorative practices. And then thinking about and honoring all the different cultures and the wisdom of those cultures and how they heal, right? The indigenous, the African, the Eastern cultures, we don't do enough to actually lift up those assets and leverage them. And that's the work that I am personally committed to, and that I know that my team will be leaning into. So thank you for those questions.
Thank you. If I could just have one last question. Madam Chair, I know you've been very patient with me. Thank you. Thank you so much. I might need y'all to help me later. So in terms of what I've heard today, I've heard a lot about training folks on cultural competency, training folks on restorative justice, training. Who are we hiring to do these trainings? Who are we contracting for these trainings? Who internally is doing these trainings? How often are we doing these trainings? And you don't have to have all the answers for that right this second, but can we get that? Can somebody send the council who you're contracting for these trainings, who's actually leading these trainings? Because who's doing the trainings and how often they're doing the trainings is just as important as having a training in the first place. And so if I could just get that, because when I hear training and resources and we're going to do a peer mentoring, all of that is stuff that we can't track. I can track names, I can track times, I can track dates. I can't track, the pejorative. Like I train my staff often. How often? Very often. Okay, great. I need the names. I need who's doing it. I need to know all of that, what their qualifications on those grounds are. So you don't have to answer that now if you don't have it, or if it's not time sensitive. Just send, if we can, and Madam Chair, if you could just ensure that that gets sent out or responded to, I'd love to know who we're contracting for that.
We definitely can get you the data on what we've been doing. And I would just say that from the social emotional learning side, that's being done by the director of social emotional learning, the Boston Public Schools director of SAL, Carla Burley, and her team. On the RJ side, Elich can share on that, but we definitely can gather data and get back to you when, how, and how much.
Thank you so much. Thank you to all of you, by the way. Thank you. This has been very informative. So thank you to all of you. Thank
you, Councilor Arroyo. Councilor Bach?
Thank you so much, Madam Chair. I think those are all my questions for now. I'm glad to know this team and who's on it. And I know that, we'll likely be chatting with you all this year in light of the school budget and thinking about how we support our students in coming back from this really difficult year. So I look forward to those further conversations, but for today, no further questions. Thank you, Madam Chair.
Thank you very much, Councilor Bach. And Mr. Cobb, if we know that we have public testimony, would you please let me know? It appears we may not have any, but I do have a couple of wrap-up questions for myself. We know that we won't have a full-time equivalent provider of any sort in a number of our schools. What is the plan and the response to those school communities for the new school year?
Counselor, every school has a school psychologist and a district social worker assigned to them. That's standard procedure. In some schools, the school psychologists are there full time. In some, they're only there 1 day a week. So obviously we will have less schools that don't have at least one person, given this huge social work investment, but there will always be a school psychologist assigned. Obviously we would love to have them at an increased capacity at those schools. And again, the district social workers will still be assigned to some schools.
Great. Certainly the work and the title of this hearing was to work to ensure that we had a full-time provider in each one of our schools. So that certainly is my commitment and will continue to be the work that I advocate for. I imagine that none of you would disagree with that, but recognize that there's certain things that need to happen to make sure that that happens. So I'll continue to work on that. And then from the presentation, and I certainly understand the tiered approach to the work and providing services to our kids. I do worry, though, that it's sort of a fail up approach, and where we know that our, sorry, my lovely puppy is right next to me here, and getting the cookies I was trying to snag for myself. We have this fail up approach, and I think that it's safe to assume that many of our kids will be at an advanced degree of trauma, and certainly what they've experienced this last year will greatly impact them. What is the directive to providers and to school communities to be hypervigilant and aware, and additionally aware about what many of our kids might have been facing over this last year, and how they may be presenting when they come to back into our school communities?
You want me to take that?
Well,
take this one.
Sure, I'll jump in. What is the directive to our school staff, educators, you're saying? So Jill, I don't want to, I can start with saying, I think folks, one of the mantras that BPS has kind of held up in our school superintendents and our school leaders is Maslow before Bloom, right? Recognizing the need for psychological safety, for basic needs in order for us to thrive. That's not, and the danger there is for that not to be used as an excuse for kids not to learn and to not thrive and to not create the conditions for that, but it is to recognize that, again, healing is an entry point to learning. It's the way in which we can all learn together and thrive together. So that's that's certainly front and center. And I think teachers, have recognized that even for themselves, that they are everyone needs a little bit of grace and a little bit of more vigilance around how are these pandemics manifesting in the way in which we bring and present on a day-to-day with our young people. Jill, did you want to say a little bit more?
I think you said that very well, Leach. I would just say that again, we're focused on, adult social emotional learning in a way so that they're setting a climate and expecting that the practices in their classrooms are building relationships with students foundationally so they know their students and are able to identify where there might be needs to have additional supports from the behavioral health team that are in schools. We really feel like that we have to, the expectation was, that all classrooms would have some routines that would be checking in and would be building relationships with their students. So we're going to double down on that. And so thank you.
And I have one more question that's going to shift gears just slightly before we wrap up. But I do want to emphasize how important, as we onboard, especially in the next fiscal year, a significant number of providers and social workers in particular, that we're working every day to retain them, to make sure that morale is high as the work is difficult. That we're working to retain those teachers. Providers, social workers, all of them. We also have to work to retain our teachers. One of the things I've noticed in many of the conversations I've had over this past year, and I think it came up in a hearing this fall, is the impacts of greater use of technology, the virtual learning, and the opportunity that has created for some online bullying, cyberbullying, access to inappropriate materials, and the impact that has had and continues to have on our children and our students across the district. Is there an opportunity to interface with the technology department, in particular, those that are watching for and paying particular attention to any of the negative components of the added use of technology for our kids? Anyone?
I don't have an answer. It's a great question.
I think there's been first, your question is, are we working with the technology department in any way to kind of monitor whether there's more of that, the bullying?
We know that there is more of it.
Yeah.
And so students that are exposed to it directly and indirectly are facing, I think, added trauma. Certainly whether they're victims, victimizers, or observers, that is, has a certain impact on young people. I wonder what particular attention we're paying to that as children and young people and families need supports around that.
So first, I would say, there's been a lot of attention to that. Our equity office had a student campaign to raise the issues for all students, that this was something, what the expectations were, and it was student developed campaign around anti-cyber bullying and bullying in general, but especially cyber. And we've also been focusing on that as a topic of health education. And then we also have supports around that where students are identified as either being a victim or a victimizer of it through Succeed Boston. So there has been, and we've been doing a lot of trainings for school staff. I'm sorry to bring the trainings again, but trainings around school staff about this issue and how to prevent that and how to work with students on that. So it really is a tiered, what are we telling all students through campaigns and health education? What are we doing at a tier 2 level when students are either needing to talk through that? And then if students are identified either as victims or victimizers, how do we bring support and repair those things? And we do have strategies at those three tiers.
You're on mute, Counselor.
Almost made it. I'm very grateful for your presentation today, your thoroughness in your presentation today. And, I know that this is, as much as our children have been challenged over this last year, and those that work with and for all of you have been, hyper vigilant through this work. I know it from my colleagues. I know it from my sister, who's a school counselor, and hear it from our parents, and hear it actually from our kids too. So grateful for I just want to, through you, grateful for the service of all of our social workers, school psychologists, school counselors, pupil, all of the titles, all of the professionals, all of the providers, just grateful for their service. Ron, I don't believe we have any public testimony. So I think that we will wrap up today's hearing. And again, appreciate all of you. Know that we will talk more about this both online, offline, and through the budget process, which is coming up soon. Thank you, everyone. This is the end of today's hearing.
Thank you, Councilor.
Thank you all.
Thank you, everyone.
Bye.
Bye.